All attendees are in listen-only mode.
Welcome everybody. Thanks for joining us today on our webinar, You Shouldn't Have to Be a Rocket Scientist to Access Services for Children with Disabilities. Just love that title. Well, I'm Pip Marks. I'm the Project Director for Family Voices of California, and I will be co-hosting today's webinar with my wonderful colleague Elaine Lynn. But before I introduce our wonderful speaker, Sarah Taylor, I'd like to let you know a little bit about Family Voices of California. We are a statewide coalition of locally based parent-run centres working to ensure children and youth with special healthcare needs receive quality care. And as the state affiliate of National Family Voices, we are California's federally funded family-to-family health information centre, and we provide statewide support and resources to families of children with special needs. Our webinars these webinars serve as statewide trainings, sometimes nationwide, and I know that we have folk on this webinar today stretching as far as Canada, so that is really wonderful. But there are statewide trainings on various child health topics and are geared towards very diverse attendees, professionals, families, parent-to-parent resource staff, advocates. So a little bit about the platform we're using. If you have any technical difficulties, you can call GoToWebinar directly at the number on the screen that you see. And due to feedback issues, we also have everybody on mute from our end. Throughout the webinar, feel free to type in questions that you have in the little box on the right-hand side of your menu. We'll stop periodically to address questions, and we will also have some questions for you that we would like you to put your answers into the question box, but more about that as we move into the webinar. We will also have time at the end of Sarah's presentation to have Q&A. Today's presentation is being recorded and will be posted on our website along with the accompanying PowerPoint slides. And afterwards, you're going to be emailed a very short evaluation survey, and we thank you very much in advance for taking the time to give us your invaluable feedback. Well, it is now my pleasure to introduce Dr. Sarah Taylor. Sarah is an associate professor in social work at California State University at the East Bay. Sarah is a teacher, a scholar, and a facilitator with over 20 years of experience in social services and higher education. And as a deep generalist, she focuses on promoting well-being, building collaboration, and reducing inequities across human service systems. Sarah explores these themes in a variety of contexts, including higher education, mental health, disability, and LGBTQ communities. Outside of her work, Sarah enjoys local and international travel, vegetarian cooking, and lots of walks in nature with her family. She is developing skills as an amateur radio host for Access and Inclusion Radio, which is 91.6 KACR LP Alameda Community Radio Station. So Sarah, thank you so much for joining us today, and I have the honor of handing it over to you.
Thank you, Pip. All right, can everybody see my screen now?
We can. I'm sure okay, everybody can.
Marvelous. Thank you so much, Pip. I'm really, really happy to be able to give the presentation today. You shouldn't have to be a rocket scientist to access services for kids with disabilities. Oh, my presentation seems to be stuck. There we go. Okay, so the agenda for our time together is a little bit of introductions, which Pip already gave a lovely one about me. I'll say a little bit more. I'm going to talk a little bit about the problem of service disparities for kids with disabilities, some of the solutions that are being tried, and then we'll have time at the end to brainstorm a bit about our solutions. I want to do some acknowledgements first. So a lot of the work, this presentation is a combination of my research, my teaching, and also my personal experience. I'm a parent of a child with a disability. The picture you see is from Big Sur this summer. That's my son. He's a very big boy now. He's 11 years old. And I like this picture because he's sort of marching off into the beautiful but unknown wilderness. But I was right behind him. So, but anyway, I sort of feel like that in a lot of my research, that I'm approaching something that I'm just beginning to learn about, and I'm fascinated by it, but I'm also a bit overwhelmed by it. And I would say that's true of my parenting journey as well, that it's beautiful and sometimes overwhelming. My son is 11 years old. He has Fragile X syndrome. And if people are interested at the end, you can ask in the questions and I can tell you a bit more about Fragile X. But basically, it's a genetic condition that causes a variety of challenges, including intellectual disability and some symptoms of autism and ADHD. But all that aside, Quinn is actually a totally remarkable young man. What I would like to share in terms of acknowledgements is that my Department of Social Work here has been very supportive of my work, both in terms of actual funding of some of the research that I'm going to be talking about, but also just in general in terms of colleagues' interest and having a flexible schedule. And I'm sitting in my office right now with a big sign on my door that says I'm doing this webinar, and I can't come out of my office for the moment. I'd also like to thank the survey and interview participants, because as you'll see in the presentation, their voices are very important in all of the work that I do. And if they weren't willing to share their stories with me, I wouldn't have anything, I wouldn't have any research. I'm very appreciative to Family Voices of California for making this webinar possible, and in particular to PIP. And I have a colleague in Australia, Dr. Amy Conley-Wright, who has collaborated in a lot of this research with me. And then finally, I feel that I'm very lucky to have what I really think of as an incredible network of support and a hive mind of fellow parents that not only support me personally, but professionally as well. And many of them have given me a lot of great ideas for my research. Before I continue with the presentation, I just want to take a minute to find out a little bit about who is here on the call today. So I'm going to ask Pip to show the poll, please.
Okay. Whoops. I don't, oops. I'm sorry, I'm having trouble launching it, but I will. Let me just try one more time. We might have to, oh, yes, there it is. Does everybody see that, I wonder?
I can't see it.
Okay, let me.
Oh, I see something now.
Okay. So I am hoping that everybody can take the time just to check which area they fit into here, and it doesn't look like, if you hit other, please specify, it doesn't look like it gives you that opportunity to write in anything. Sorry, Sarah, I'm not sure that this is going to work. So would you like to continue with your slides?
Sure, yeah, I couldn't see the poll. But
the results. I see a poll and I see that we had 68% of people voting. So I'm thinking that our participants were able to, at least many of them indicated that who they were. And 40% parent of a child with special health care needs, 10% friend or family member, 40% service provider, 3% K through 12 teacher, and 30% other.
Thank you, Elaine.
Excellent. Well, it's great to know a little bit about who's here, and it sounds like we have a lot of diverse experiences that we're bringing to the webinar. So I'm really happy about that. So one of the things that I like to look at sometimes on social media are silly memes, and so I think these memes get at an experience that a lot of us parents have around a lot of the bureaucracy in trying to access services for our kids. So anyway, you see this one right now that says the paperwork required when you have a child with special needs. A picture of Wonder Woman just getting ready for tomorrow's IEP meeting. IEP prep as a coffee mug and IEP recovery as a wine glass. Indiana Jones, this is your face before an IEP meeting where he looks very determined. This is your face after an IEP meeting where he looks like he's been through quite a struggle. And then a sort of a cartoon, Mommy says it's not a real IEP until somebody cries, preferably not her. Another one of a woman crying. The IEP meeting lasted 2.5 hours and we didn't get to the goals. And then finally, this one's more about accessing medical care, but hey girl, I know you've been dreading writing that appeal letter to the insurance, so I wrote it for you. All of these are kind of a humorous way of getting at really a very difficult reality that for many parents of kids with disabilities, they feel that just simply doing the minimum things that are necessary to access services for their children feel like they have to be a superhero, or that they require some kind of special energy or determination just to be able to go to the IEP meeting or to fill out the paperwork that they have to do. And so this is kind of a big problem. One of the things that I teach is social policy. And so this is a model I teach my social policy students, which is a very quick look at how the social welfare system is supposed to work. So, and social welfare, a lot of times people think welfare as being simply cash handouts for people that are low income, but which that is a part of our social welfare system. But actually our social welfare system is much broader than that. It's intended to include all of the things that we do as a society to distribute social goods and ensure social well-being for really everyone in our society. So the social welfare system includes not only cash payments for people that are low income, but having access to affordable housing, having health care, having mental health care, having public schooling, and of course having appropriate supports and accommodations for people with disabilities. So when we think of the social welfare system, often there's some kind of social issue where we recognize that there is some societal need that that we would like to be addressed. And so out of that social issue, people debate about what is the issue and is it really a social issue? Sometimes some issues come up and people will say, well, I don't think that's really a social issue. I think that's more of an individual issue. So a lot of what happens at that first level is just agreement on what is the issue. And then at the second level, people have some agreement enough that they can create some policy goals. They can say, okay, well, we have this social problem or this social issue, and now we want to address it, and here's what the goal of addressing it should be. And then they write some legislation or create some regulations that will hopefully implement and make real those policy goals. And then there's a program that comes out of all of that process where that's what you really see on the ground. You know, and that's the thing that we experience most frequently as parents and as people with disabilities is that program. The problem with this system is at every point as you go down the levels, something gets lost. The policy goals often don't quite capture all of the complexity of the social issue. The legislation or regulation often ends up being a result of a lot of compromises between various stakeholders about exactly what kind of legislation we want to have. And then the program often varies considerably from one local area to another, and even within the same city, two programs that are essentially meant to do the same thing might do very different things based on the staffing there and some of the decisions that supervisors and others might be making. So we never quite, with our programs, match the social issue and the social need. So in disability services, this is particularly problematic because there's a lot of kind of current debate and discussion at all points of that diagram that I showed on the previous slide. So there's a lack of agreement right now about how even to conceptualize disability. What is disability? People have very different ideas about that. And so that disagreement trickles out into a lot of our legislation and our programs. A lot of the research I've done shows that there's a lot of points of tension with parents and providers and programs around eligibility. And that's because we don't have an agreement about exactly who might meet criteria for disability for a given program. Right now we have a tension between medical and social models. So in the medical model, people with disabilities are seen as having a problem that needs to be fixed. And in the social model, the society is seen as having a problem because it is not sufficiently accommodating and accepting of people with disabilities. And so I think in the past, the medical model was really dominant, and it still is to a certain extent today, but we're slowly moving towards a more social model where we want to create schools, churches, organizations, all kinds of things that are designed to be more inclusive in the first place. Along with that, we're moving away from segregation towards full inclusion. In the past, children were almost always educated in a separate classroom, and though we still often have special day classes, and my own son is in a special day class, pretty much at every IEP meeting, what we're talking about is how can we include him more. And I think that's a conversation that may not have happened as much in the past, because more and more we want to see children included with their peers. The other thing to keep in mind with disability is that despite all of these tensions, most disability policies, whether they be in medical care, social services, or education, have a stated intent to serve all children, regardless of socioeconomic status, race and ethnicity, religion, language, and other aspects of human diversity. So looking at this social welfare system chart, you can see based on these kinds of tensions that even defining the social issue, what the policy goals should be, and then the legislation and regulation and programs are kind of all up for grabs right now because of all these tensions. And despite all that, when we think about the social issue, I think most policymakers would agree that we want all children to have access to the services that we do have. What I'm finding in my research is that that's not the case. So there's a mismatch often between the goals of serving all children and what actually happens. And I'm just going to run through a few examples of that. So one example is that in diagnosis, research has shown that children who are of higher socioeconomic status are more likely to be diagnosed with autism and more likely to be diagnosed earlier in their lives than children that come from a lower socioeconomic background. There's potentially a lot of different reasons for this, and some of which may be very, very good reasons, but of course, it's not possible to access disability services if you don't have the diagnosis that would allow you to access those services if in fact the child would benefit from those services. So the fact that there is this discrepancy between higher income families and lower income families is kind of a problem. When we look at spending across the state of California for regional center consumers, and for people that are joining this webinar from outside of California, regional centers are the local sort of clearinghouses for all disability social services. They do the payment and referral for things like early intervention, and as a child gets older, for things like respite, for programs for adults, like job training programs and things like that. And what we found over the years is that white families are receiving a lot more regional center services statewide than Latinx and African American families. So in this chart here, you see that the average spending per consumer per year for a white consumer is $18,171, and yet the spending for a Latinx consumer is $8,356. This data is from California State Senate Human Services Committee that is really digging into a lot of these disparity issues because they're very prominent right now as people are realizing how serious the problem of disparities really is. Many people are already aware of that in special education, we also see racial and ethnic disparities. So there's a very wide disparity in who gets identified as having a disability, and there's both over-identification and under-identification happening. And both of those problems are in part, racial and ethnic disparities are present in both over and under-identification. Many children of color with disabilities, especially if they are over-identified, end up experiencing a segregated education system where they're more likely to be put in those special day classes. And the rate of suspension for children with disabilities is different for children that are African American, Native American, or multiracial. Even though they have a disability similar to their white peers, they're more likely to experience a suspension. There are some provisions in the Individuals with Disabilities Education Act that are intended to address some of these disparities, but research has shown that they're not really being utilized the way that they should be, and that there are also problems in coordinating special education services with early intervention services that disproportionately affect children of color. So all of this adds up to a special education system that is just reinforcing the disparities that we have in many other areas of disability services. So there's a whole lot of reasons why this might be happening. As sort of indicated by those humorous memes that I opened up with, disability services often are embedded in a very complex bureaucracy where people feel like it's hard to understand what services are available, how to access them, and then even when you do know, you can be kind of overwhelmed by the paperwork and the long meetings and the requirements. There's also a concept called street level bureaucracy, where people that implement things on the ground often end up having a sort of a disproportionate amount of power. And that's where thinking about that diagram of what happens in policy, your experience, and I think many of us parents of kids with disabilities have really experienced this, where with one special education coordinator, we might feel that our child has access to a lot of things. But then if there's a turnover and a change in staffing, suddenly it's a totally different picture. And that's because that person, even though they're supposed to be implementing the same policy, the Individuals with Disabilities Education Act, they're making sort of street level or case level decisions that are very different from one another. There's also been discussion that a lot of the documentation that is used to determine eligibility and to shape services for children with disabilities is not culturally or linguistically accessible, and that the services themselves are not culturally responsive and are often insensitive, and that trainers do not have, providers do not have the proper training to be able to provide culturally responsive services. I want to take a little pause right now and give folks an opportunity to kind of chime in with some of their additional ideas about why this is happening, why we have these disparities. Pip or Elaine, can we open up a box for people to type their ideas?
People can go to
into the questions box, and I can review those from here.
Sarah, there was one question saying in the disparity chart that you showed with the African American, Latino, and was there any, any results where the Asian population is part of that? Do you know anything about how?
I didn't have that from that report, but at the end I'm going to provide my contact information And I can look that up, and I would be happy to provide that information if I can find it over email.
Great, thank you. So we're not getting any responses to your question of why is this happening? What do people think?
It's a quiet group, huh? All right, well, people can kind of have that in the back of their minds and just be thinking about it. And certainly as part of the discussion at the end, please feel free to add your thoughts about some of the reasons why we see these disparities.
Well, actually, Sarah, I'm sorry, some have come in, so Elaine's going to bring them to you. Do you want me to start, Elaine?
I can see some now, excuse me. Perhaps income differences. Disparities between some disabilities and others, such as intellectual versus physical disabilities. Testing, eligibility may be different. There's some racism, income and education level, just another discrimination, which is similar, due to a lack of knowledge on a particular diagnosis, lack of education for staff, and something related to the income disparity. Affluent populations can hire advocates and attorneys to get guidance. Whereas less affluent populations cannot. Difficulty with funding, such as you must sort of fit into a specific box or category to be eligible. Knowledge of services available, rural versus urban. Lack of understanding of the system and how to navigate it. Medicaid status. Those are the things that folks have been listing.
Those are all excellent, and I definitely think are a huge part of why this is happening. One of the things that that somebody shared that I hadn't really thought about and should think about more in my research is the rural versus urban issue. I think that would be something that would be really interesting to explore further. So thank you everybody for sharing your ideas. So I'm going to shift a little bit now to talking about some of the research that I've done. So my colleague, Amy Conley-Wright, that I mentioned at the beginning, she and I have done an online survey of over 300 parents of kids with special needs. And surprisingly, we got some international representation. One thing that was very interesting is that when we initially put out our survey, our goal was, we thought, well, if we got about 100 responses of people in California, that would be very good. And then it ended up getting 3 times that amount, and people from all across the country and a few from places outside the US. From that survey, at the end of the survey, people were invited, if they wished, to complete an in-depth phone interview with one of our researchers. And so 47 parents did that. The overall emphasis of all the research is basically on the how parents advocate for their children, what kinds of things do they do, when they advocate, what are their goals, how does advocacy make them feel, what's their reflection on their advocacy, and what kinds of knowledge and skills do they feel they need to be effective advocates. One of the things that's been really interesting for us is that this was kind of an accident in our research. We had hoped to get a very diverse sample. However, I think because of limited resources, just funding for our study, we did a lot of our recruitment through social media and email lists. And so both in the survey, but even more so in the phone interviews, which came out of people that completed the survey, we really have an overrepresentation of families that are white and families that are middle class or even affluent. And as social work researchers, we were very disturbed by this because we feel that it's very important to learn more about the experiences of families of color and low-income families. However, when we dug into our data, what we found kind of surprised us in that we have a big question in the interview where we ask people, so you've told me some stories about successful advocacy, and can you tell me what you feel has made you be a successful advocate? And we were a bit surprised that one of the things that came up again and again it was a sample that was you know, sort of professional and affluent families and a lot of white families. They referred to their professional background and or their educational background. So I'm just going to run through some of these examples to give you a sense of what parents told us. How did you first learn of your son's special needs? How did I learn of them? I suspected them. I'm a physician myself. So he was actually the first patient I actually saw with autism. And it took him in requesting a developmental screening for him about 16 to 17 months of age. Another parent said, I've been fortunate that I have private insurance and I help people in the community, so I can ask about different providers. But I mean, again, it's like I have an advantage in all this being a social worker with my skills and connections. And sometimes I think and go, oh my God, what if I wasn't a social worker? Another parent said, it just struck me that my whole professional career up to this point in some ways was a preparation for me to be an advocate. My professional background is as an editor and writer and marketing communications person. So whether it's learning new material or getting the material out to people in a convincing way, it's really all about advocacy. Another parent said, I would be lying to you if I didn't say the fact that my husband and I are well educated is a huge factor. He is an attorney. We both have master's degrees in public policy. We both work for the federal government, so we understand how bureaucracies work. We understand how to lobby and advocate, how to work the system and call people and write letters, and how to write good letters and all that stuff. And then finally, this is the quote that led to the title of the presentation. I think my educational background has helped me a lot. I have a degree in astrophysics, so I'm used to learning complicated stuff and trying to apply it to different problems. I'm a good problem solver. So wow, when we saw this, we thought, even though our sample we had arrived at sort of accidentally, and though we do want to in the future do a much better job of recruiting participants who are from low-income families and families of color, we felt that we had learned something that we didn't expect to find, which is that families that have more resources really do bring a lot to the table that they feel gives them an advantage when they are trying to access services for their children. In addition to this, the parents, when they the other thing they talked about was that their knowledge of policy really encompassed a classic policy framework. Like when we asked them more questions about, well, tell me more about how you accessed this service or how you were successful. The parents knew a lot about eligibility, program goals, benefits, the service delivery system, costs, and financing. These are things I teach students in my master level policy class, and these parents, you know, would have gotten an A in my class. They already had all this knowledge. Parents often felt they were more knowledgeable about their children's condition than their providers were, and they felt they needed to be because they weren't going to get the services their children needed unless they were more knowledgeable. Parents used a whole lot of different skills, as you kind of saw in the previous slides. They talked about their written and oral communication, their networking, their leadership, the argumentation, public speaking, and more. One thing that really stood out to us also is that even though these parents were very knowledgeable and skilled, they still felt they needed to be extraordinarily persistent to access services, even coming to the table with the advantages that they had. So parents said things like, I'm the squeaky wheel, I'm the person that just never goes away, I'm the person that calls back again and again and again, I'm the person that just won't take no for an answer. Okay, who else do I need to talk to? What other things can I try? And another parent said, I'm tenacious, I'm stubborn, I'm persistent, I'm very confident with research, and once I set my mind to something, I'm hard to persuade different. So I guess my tenacity and my persistence would be my character strength. And of course, when we look at this, we think, wow, these parents have all these advantages and they still have to be very persistent and work very hard. And then I can't help but wonder about all the parents that don't sit by a phone all day and can't call back again and again and again. The parents that are working 3 jobs, and how can they make time in their schedules to do what seems to be required to access services that, again, back to the policy goal, these services should be available to everyone, whether or not they can be a squeaky wheel and whether or not they have special knowledge and skills. So this is just maybe one part of why these disparities exist. And there are efforts going on to sort of address these disparities, and they're happening both at the individual family level, the local and community and organizational levels, and at a policy level. And what I see is that there are unique opportunities for nonprofit organizations to partner and support families at all of these levels. So just a few examples. I know a lot of people out there know about the work of DREDF, the Disability Rights Education and Defense Fund. They do work at all 3 of these levels. They train individual families, and they do legal work that actually shifts policy for everyone. In California, there's a disparity funds program which is intended to promote equity and reduce some of these disparities. And this is a grant opportunity for community-based organizations to develop and offer programs that will do all sorts of things to reduce disparities. For example, they might have a parent training program that gives parents some of the skills that the parents in my study already seem to have from a lot of their professional backgrounds. There's also recently been, in October 2017, Assembly Bill 959 was passed, and sadly, this bill is it's a good bill, but it's very small in scope. Like when I tell you what it does, it might be sad that it's even needed to do this, but it says that regional centers will list on their websites the services that they offer. And that they will make the list of services and information about how to access services available in a culturally and linguistically appropriate manner. So to me, this is a great thing, but seems like a pretty minimal change that it surprises me that a law was needed to get people to do something that seems like it should be a pretty straightforward thing to ask of an organization, that you list the services that you offer. One trend that I think has the potential to shift some of these disparities, both in a positive direction or in a negative direction, is self-directed disability policies. So in California, we have a pilot self-determination program where consumers, or if they're conserved, their family members, could be in charge of managing their own services more directly. So the sort of existing model is that if I want a regional center service to be made available to my child, I call the regional center caseworker assigned to us, and I ask them about it. And that's an opportunity for them to exert, one, to share their expertise, if I look at it positively, but it's also an opportunity for them to gatekeep and prevent me from accessing that service if I feel our family needs it. Under a self-determination program, that person is sort of taken out of the picture, not completely, but at least partially, so that in the most transformed systems that are moving towards self-direction, the consumers and family members actually have a sort of a bank account that they can use to pay for disability services, and so they are selecting, approving, and paying for services on their own with funds that they get from the government. This policy is moving much further and faster along in Australia, where they have the National Disability Insurance Scheme. And as I have on this slide, these kind of self-directed schemes have both potential pitfalls and potential opportunities. So in terms of pitfalls, there's potentially even a greater need for families to be knowledgeable and skilled, because they're going to have to navigate, without the expertise of any kind of case manager, the services that are out there in an increasingly privatized and fragmented sort of service marketplace. So that requires a certain amount of savvy to be able to go out there and kind of on your own figure out what's there, and to be able to access it. And so there's a potential that existing disparities could grow even more. However, there are opportunities in self-directed policy for consumers, families, and providers to work together to develop locally relevant services. So one of the hopes is that because families will have more control, they can really sort of vote with their feet, and they can exert some pressure on providers to provide the services that they want, because the families will be holding the money. And that there's the potential opportunity of a greater sense of autonomy by consumers and family members. My colleague and I have been working a little bit on this, and out of that same body of research of the survey and the interviews with families of kids with disabilities, we did kind of a separate analysis to look at the relationships between parents and not-for-profit organizations. And what we found is that looking more on the opportunity side of these self-directed services, a lot of parents in the interviews talked about reciprocal social support as being very important to them, and talked about how nonprofit organizations facilitated that reciprocal support. So basically, allowing parents to do peer support with one another, and that felt very good to them, to be able to have a fluid role where at points in their relationship with the nonprofit organization, they felt like more of a client, but then at other points they felt more like a volunteer or a provider. And many parents ended up doing things like joining the board of directors or becoming an employee of a nonprofit organization as they grew. Because of this opportunity for reciprocal social support and fluidity in the kind of roles people play, parents talked about that they were building competencies and leadership skills, and had an opportunity to advocate at some of those higher levels in terms of organizational levels and policy levels. And then ultimately, if this keeps going up the pyramid, there's a hope that nonprofits and parents can work together to create services that have a good cultural fit, and that there's a meaningful partnership, and perhaps we can get a little bit closer to realizing those policy goals of making services available and accessible to all children. This is all sort of idealized. Obviously, we're not there yet, but what my colleague and I felt is that in our data, we could see that there definitely is that opportunity to get to the top of this pyramid, and so we felt that it's our job as social work researchers to try to figure out how do we help move organizations to the top of this pyramid. So we can take a little bit of time now to, I have some questions for you all, and then in a couple more slides, you can ask me any questions you want, but I'm really curious to hear from people about how do you see disparities in access to disability services happening in your own community. I'm also interested in any local efforts that you're aware of to address these kinds of disparities, or any ideas you have for eliminating them. And also thinking about self-directed services, I named some potential pitfalls and opportunities, but I'm curious to hear more about what you all think. So you can pick just one of these issues if you want to use the question box to type up some of your ideas. It would be great to hear from participants about any of these areas.
We have one comment related to disparities in local communities, a lack of diversity of service providers, and a lack of culturally appropriate interventions. And someone mentioned in their community where there may be low expectations due to a lack of cultural understanding by schools, and therefore a failure to intervene because they consider the kids quote unquote lost causes or beyond hope.
I definitely think those contribute to some of the disparities we see.
And then another person commented, I don't even know how to apply for SSDI.
Are other comments coming in?
One by one, agencies don't communicate with each other. It makes it hard to provide fluid services. We have programs specifically designed by and for Latino communities to reduce barriers for families. Pure translation and interpretation does not address the cultural barriers that exist for families. Lack of providers in rural communities, which forces families to travel for services. Some disabilities might require more funding than others. If the system is set up that everyone gets a certain amount in the bank, then there will still be a disparity because some kids need more services than others. Someone from South Los Angeles comments there are a number of low-income families and bilingual groups, and in these communities there's been a sort of parent-created support groups where these parents have really united in sharing their stories and experiences as well as techniques and skills, and really creating a lot of unity. And then another comment, in terms of eliminating disparities, regional centers are required to post expenses as to each cultural community and participation in a meeting where the numbers can be reviewed. I know they just went through that process. Let's see. A disparity in programs for certain disabilities. Someone comments, I do not understand why there are so many programs for autism and not just programs across the board. Okay, similar scenarios of disparity when parents are just uninformed and overwhelmed. Full, rich information of choices and possibilities within special education, for example, are not as readily provided, and this seems to happen regardless of cultural and ethnic background. Many families want agencies to use web-based applications, and not everyone has access to computers or internet, especially in rural communities.
Definitely.
Many more coming in. Agree with the potential pitfalls that you named related to self-directed services. Funding must be available for some form of family navigator that is culturally and linguistically responsive to the community needs.
Definitely.
We lack social connections in our communities, and we allow fear of what is different to be a wedge between us at times. And then therefore, there's sort of competition and tension for bits and pieces of funding. If people have to take the time to take their kids, to different services, it's difficult when you are working. Might not be able to take that time off. We need local community spaces open to all people with all disabilities to come for one-on-one family navigators. Someone from Virginia says that in their state they introduced a guide to an inclusion project that could be done through schools to get everyone involved in disability awareness.
That sounds really interesting.
In self-directed services, the advocate would seem to be working more for the family than protecting the organization from expending resources.
I would hope so. I don't know if that always works out that way, but I would hope so.
A lack of social skills programs, problem. And then someone comments on hosting of a NICU, Neonatal Intensive Care Unit, family symposium in November. This was in Northern California and Sacramento area, I believe, that brought professionals and parents together to share and connect with each other. And it brought everyone under one roof to create a conversation. The feedback was remarkable. Both professionals and parents reported that they left knowing more about what they didn't know. Information online and hard copy only goes so far. Bringing people face to face to just talk is still the best way. Each case is different. One size does not fit all. Lack of programs as kids get older. Older students are told that they have aged out of some services, and that seems like older children are being discriminated against.
Well, thank you. That is a lot of excellent responses to some of these questions and some of the other things that I've talked about. One thing I'll mention about this, a couple of the comments were related to the need for more culturally and linguistically responsive services. And I do think that that is a possibility, you know, in general, but in a more self-directed policy context, and given some of the fluidity in roles and reciprocal social support that can happen in a nonprofit that is really meeting the needs of the community. And an example of that is an organization called Thrive in 5, which is out on the East Coast. And they have a really interesting model where they think of parents as initially, rather than clients, they think of them as the parent is the child's first teacher. And then they think of parents moving through various stages to be more of a provider. And they have trained a lot of parents to be parent screeners for parents that suspect their child has a disability. They now are able to send parents that come from local communities and neighborhoods out to people's homes to do that initial screening and make the connection. And these parents that are from the neighborhoods that they're working within speak a lot of the same languages as the parents whose homes they are going to, and have a lot of local knowledge that's more relevant to parents than a provider that might be across town. And so by training parents to be that first connection with the organization, they are better able to provide some of those culturally and linguistically responsive services and to get more services out to all the various neighborhoods of the city. So I hope that we see more models like that, where we really empower parents and give them the resources they need to support other parents, and also to kind of create a positive feedback loop where organizations are really very much in touch with the needs of the community. So just to wrap up, I'm just going to show you this slide, which is some of my other papers and presentations, and I'm happy to share anything with folks. Here's my contact information. You can email me any additional questions that you weren't able to ask in the webinar, and if you email me, I can also send you PDFs of some of these articles or other things that you might be interested in. And I think now we have a few minutes for any final questions.
We do have a question regarding the Thrive in 5 program. The question is, do you know if that program reimburses the parents who they have trained to do screening?
The parents do get stipends. I have no idea how much the stipends are. I would hope that they are a fair stipend for the work being requested.
We have another question regarding addressing some of these disparities. We're now very aware of all of these. Are there additional things that we can think about doing to address them?
Well, I think for me, I'm paying attention to some of the legislation around this, like that in California, the AB 959 that I talked about, and now this whole issue is sort of on the radar of that oversight committee for our California State Health and Human Services. So I'm going to be kind of paying more attention to what's going on in that committee and see how I can help advocate for and possibly inform some of the work that they're doing. So that's kind of a policy thing that I would encourage people to find out what's going on in their state if they're not from California, and see if anybody is working to address this issue already and how you can advocate for or support those efforts. On a local level, I know one thing that I try to do, which makes me maybe unpopular in my school district, is I'm not, because I do have some of the knowledge and skills and time, just because I work in an office and I have access to a phone and a computer a lot and that kind of thing. Whenever I advocate for my own child, I also try to, just nudge the district towards thinking about all the kids that don't have parents who have offices and have the time to do what I'm doing. So, I'll say like, well, I'm very glad that you're going to allow my child to do this thing or access this service, but I'm curious to know, like I just bring it up, like I'm curious to know what you're doing to make sure this thing is available to all the other children whose parents aren't able to meet with you. And that probably makes them annoyed, but I feel like on a very local level, that's something that I can do. And I also help facilitate some online groups where parents come with questions, and I try to share some of the things that I've tried to do to help my kid access some of the services. And given all of this, I'm always still learning too. Like I do come up against barriers in accessing one or more services for my kid, and where I need to go back and do my research and find out what it is I need to learn or be able to do so that I can help him get something.
We do have a few more questions. We have a request to go back to the resource page just to give folks a longer look.
Okay, sure.
That slide. And then there's a question regarding AB 959 regarding, do you know when it goes into effect?
I believe it's in effect right now, January.
And just a comment related to that, the whole spectrum of services seems to be cloak and dagger currently, and hopefully that bill will begin to address some of that.
I actually went to our regional center website recently, and it had changed. I don't know if it was directly because of AB 959, but it did in fact have more information than it used to. I wouldn't say that it was easy to navigate and that it answered all my questions, but it was somewhat of an improvement.
Okay. Right now, that's all we don't have any further questions.
Well, thank you so much, Family Voices, for this opportunity. And I definitely want to thank everyone who participated today.
Thank you, Sarah. Thank you very, very much. And to all of you for attending. So we'll close the webinar, but I just want to remind everybody that you're going to get this very short evaluation survey in your email, and we would love to get your feedback. So have a wonderful day, and thanks again, Sarah. Bye.
Bye.